We have one more speaker before lunch. And so it's my privilege and pleasure to introduce Dr. Virginia Asin Oostburg. She's going to speak on CPS breastfeeding promotion campaign. But let me tell you a word or two about her. She has an MD, and an MPH. She's a medical doctor, but she's a physical therapist as well. She has a practice. She's a lecturer, an administrator, public health worker. She has a degree in public health and health organization and planning. She's head of the Collective Prevention Services at the Ministry of Health in St. Maarten in the Dutch Caribbean. Wouldn't we all love to be there today? And she's a chief medical officer there. So she was involved with their health organizations, their disaster management chair, and disaster preparedness. So she has a vital past, a tremendous amount on her plate, but she's taken time to come here and speak with us today, Dr. Oostburg.
Good morning. So I am well, it's afternoon already, and I'm the only one standing between you and lunch, right? So I hope I will be able to keep your attention after we had such wonderful speakers before me. And before I continue, I just want to say a special thank you to Julie, because I don't know how many of you know, but the American University of the Caribbean is situated in St. Maarten. And it's because of that fortunate coincidence that through the then dean, I got in contact with Julie and we started talking. And we initially started talking about women's health, because women's health is so closely related to this subject on breastfeeding. So when I was asked if I wanted to share what we are doing on St. Maarten when it comes to breastfeeding, of course I said yes, because you realize that also when you go through the literature, breastfeeding is such an important discussion. And although from the position where I am in, you are involved in different subjects when it comes to public health. And Ruth just mentioned also disaster. One of the main focuses in our department is on maternal and child health. So thank you, Julie, for allowing us the opportunity to share with you what we do on St. Maarten. Now I think I need some help. Just press this one. The other way. And then just press here. Okay. And then it's this one. Okay. So this is the presentation outline. I'm going to fly you over real quick to have a sneak peek on St. Maarten. And hopefully there will be an opportunity to do the summit on St. Maarten once, hopefully. But I'm going to speak a little bit about also our government structure, because it's different than you are acquainted here in the United States. And finally, I'm going to talk about our breastfeeding activity. So a quick flight into St. Maarten. So when you land, you will have this exciting experience that you're almost landing on top of the persons they had who stand on the coast and wave into you. It's, I think, within the 10 most dangerous countries to land, but it's so exciting. Exciting when you land, but also exciting when there is a departure, because what they do is then what they used to call wind blowing. Now they have fenced it off. people would go and stand near the fence, and what the airplanes would do, the pilots, they would give a lot of gas, and then you have a lot of wind blowing, and people would literally fly when they leave. But this is St. Maarten. We are in the Caribbean. We have the Atlantic Ocean. Oh, am I doing something? We have the Atlantic Ocean on the east side, the Caribbean Sea on the west side, and we are somewhere in the middle between South America and North America. We have a very active tourism industry, but that is the same with most Caribbean countries. We have on average 4 of those big cruise ships coming to St. Maarten. So we have, sometimes we even have 9, but that's more an exception than average. So sometimes we have on the island more than 3 times the population of St. Maarten going around our streets. Hence the reason to focus on disaster and emergency preparedness also. Some demographic information. We are a small population, around 40,000 persons live on the Dutch side of St. Maarten. The average population growth is not that much, 2.8. Our total fertility rate is around 2, almost the same as in the Caribbean. Our life expectancy at birth is around 70 years for male and 77 years for female. When you look at our population pyramid, you will see that it is a slight growth in the population, but the reason I included the population pyramid is to focus your attention on what we call the bulge in the pyramid, because that says, and you see that the base is smaller than the bulge, that means that we have a very active migration population on St. Maarten. So we don't have that nice shape where everybody that is born on St. Maarten stays on St. Maarten, but we have a lot of persons coming and going through our borders, and that is what complicates our work on St. Maarten, especially when it comes to breastfeeding, but I'll get to that in a while. To say a little bit about our structure, our government structure that changed in 10-10-10, and that is the 10th of October 2010. Before 2010, St. Maarten was one of the 6 islands in the Netherlands Antilles belonging to the Kingdom of the Netherlands. In 2010, that changed. St. Maarten became an autonomous country, and together with Curaçao, Aruba had already achieved their autonomy years ago, more than 25 years ago. But with that, also our government structure had to change. And the reason I'm saying that is that when you are a dependency, the guidelines, the guidance, policy, development of programs, everything comes from the mother country and is then provided to you. In 2010, everything changes, and guess what? Now you have to do it yourself. So the change also brought with them a change in the whole governance structure, with now the country having 7 different ministries. And our ministry is called the Ministry of Public Health, Social Development, and Labor. And although it seems like an odd collection of departments, this has proven to be at the same time also a good mix, because when you are talking about introducing programs, whatever it is also important that you include many sectors, and oftentimes the social sector and the labor sector, and more specifically when it comes to breastfeeding, is very important, specifically the labor sector. So that's the government structure. Our department, our ministry has is divided into policy departments and executing agencies. And my department where I work, Collective Prevention Services, is one of the 6 executing agencies of the Ministry of Public Health, Social Development, and Labor. What do we do in our department? The department consists of two sections, Section Youth Healthcare and Section General Healthcare. General Healthcare is working in the area of surveillance and also program development. And our youth section Youth Healthcare, is focused on youth 0 to 17 years. There we have our baby clinic, and we were happy to have Julie as one of our visitors a few weeks ago at the baby clinic to also get to know what we do on St. Maarten. And in the baby clinic, that is where we do most of our work when it comes to breastfeeding. In addition to the baby clinic, 0 to 4 years, we also have the school programs and related programs that we do that are geared towards our target population, 0 to 17 years. So, what do we promote? Of course, being here, the answer is quite clear. We promote breastfeeding. But when I was preparing for this presentation, you go back into history, you look at data that is available, and I do have to say on St. Maarten, we don't have that much data. Information is somehow recorded, but where is it? Who has it? Who coordinates it? So where do you find that information? We even realize that we have information recorded on patient cards, but what do we do with it? So while preparing for this, I looked at our information, what we had, because our activities to improve breastfeeding started in 2014. Maybe a coincidence. My colleague from who was the speaker before me, your program, Upgrade, also started in 2014. Same with us, and it was around World Breastfeeding Week that we started looking into what is it that we're doing? What do we do on breastfeeding? And we thought we did well because, we promote in hospital, you have activities going to the homes, you promote in your own organization. But then we had a student who came in, and we had that student look at 2014 data that we had. And it was amazing. I will share that information with you. In my opinion, we were doing very bad. So when you see the data, you cannot ignore the data. So 2015 for us was then the key point to say we need to up our game. But when you say, what do we promote? It's not only promotion of breastfeeding, but you need to promote the information also to other sectors, and I just mentioned the labor sector, but you also need to promote it to all the different communities where the people live. And that for us is not such an easy job. I don't think it's an easy job for many persons, but why do I say it? Before I go to the not so easy job, I also looked at what is available at where we deliver our data. So I went over the core indicators of PAHO, and I'm going to spare you the whole information on that. You can go online and find the core indicators online. But what was interesting was that you see that PAHO has recorded that the adolescent birth rate, live births per 1,000 girls aged 15 to 19 in 2015 was 47.4. And that was exactly the same number that we noticed on St. Maarten, because we have young mothers aged what we have there, 15 to 19 years, that they get pregnant, they deliver, and they have to breastfeed. But you have to teach them how to breastfeed, because looking at our data, we notice that you have young mothers becoming young mothers. So sometimes we even have in our clinic mothers sitting with their children and a grandmother, and you don't know which one is the mother because the grandmother looks young enough to be the mother. So where you think that social, and that education will come from home, think twice, because that's not the case. So you have to also look at the different communities, and we do have a large group of young mothers also delivering children. And when we look here at the bottom, we also see that PAHO recorded in 2016 that exclusive breastfeeding, less than 6 months in 2012, it was 20%. So also not such a high number. But what did we find when we were looking at our data for 2014, World Breastfeeding Week? You want to know what it is that you're looking at. And what we noticed was that we had in total 481 mothers coming to the clinic. On average, we have 500 live births on St. Maarten, and almost all babies are born in the hospital. And we noticed that we had 481 who visited our clinic, our baby clinic. And when we looked at their nationalities, they were spread out over 36 different nationalities. And the nationalities ranged from Anguilla, China, Dominican Republic, Haiti, India, Kuwait, name it. So they come from all over the place. And remember, I showed you the population pyramid and explained to you that we have a very active migrant population on St. Maarten. So when you're preparing your breastfeeding policy, you have to take into consideration all the social, economic, and cultural background that your mothers bring with them to the country. So what did we find? How did our mothers do in 2014 with breastfeeding? We looked at 4 different times over the year: 1 month after birth, 3 months after birth, 6 months after birth, and a year after birth. And we only had 12% of mothers that exclusively breastfed in 2014. And when you go down the line towards the end of the year, you see that exclusive breastfeeding gradually reducing to 6% in the 3rd month, 4% in the 6th month, and only 2% was exclusively breastfeeding after 1 year. This is the same information, but now including the declining trend line for exclusive breastfeeding and the increasing trend line for not breastfeeding. We also looked at information when it comes to combination feeding. And when you speak to the mothers and we talk about combination breastfeeding, combination not necessarily means formula feeding, because living in the Caribbean, you also have that cultural habit that persons give their children bush tea, pop. They give the children also, water. So there are different supplementary feedings that mothers give to their children because that's how they were taught in their own culture. And this number is only, so we didn't take that into account because that is one of the entry points we use to discuss with the mothers. How do you discourage a mother who has cultural conviction that this is the way to do it and tell her, no, that's not the way, you don't tell them, but somehow you need to coax them into breastfeeding and if it's not only breastfeeding, make sure that they also combine it with the right type of supplementary feeding. So when it came to combination breastfeeding, the data that I'm showing you here is only the combination breastfeeding with kinder formula. Maybe you have heard my accent. I am Dutch speaking, because in the Caribbean, in the kingdom is Dutch speaking, but St. Maarten is kind of unique in that context because we are both Dutch and English speaking. So the KF stands for kinder formula, but formula is formula, kind is child, so it's formula. So we also saw that in the combination feeding, you start with 58% already in the first month, given combination feeding, both breastfeeding and formula. And you see that gradually decreasing the combination feeding from 58% to 19, 8, and then only 2%. And I think it's already, if you also look at the previous data that I showed you about exclusive breastfeeding, it is the assumption, we cannot state it by a fact, is there that this decreasing line is because they are gradually moving in more into bottle feeding than breastfeeding. And this again is the same information and then making it a little bit more visible with the steep declining trend line. Kinder formula, we notice that 24% immediately within the first month had moved into only giving bottle feeding. And that bottle feeding only increases from 24% to, I think, 90% of exclusive bottle feeding. So this only confirms the information that we see not only in St. Maarten, but we also see the same trend happening in the United States. And when I also reviewed some historical data, and sometimes when you want to develop a program, the question is not so much, what do you do? The question is, how do you do it? And to understand the how do you do it, you need to understand what is the reason why, if it is so obvious that breast is best, how come we also on St. Maarten, where we not regularly document our data and analyze our data, but when you do it as a one-time activity, you realize that you're not doing better or worse than anywhere else. And it was very surprising to learn that even around slavery time, breastfeeding was an active discussion. And the intervention there was that the slave owners early noticed that, first of all, the mothers spent a lot of time feeding their babies. So that tells you already that there was a different kind of culture around slavery time where the people came to our region because they spent a lot of time feeding their child. And if you look at feeding on demand or feeding on time and the number of minutes it takes to feed a child, you realize how many hours you're breastfeeding your child. So they were taken out of the work because of breastfeeding. In addition to that, breastfeeding is also a kind of a contraceptive. So they were not producing children for the plantations. So guess what the slave owners did? They started to interfere. Is that the reason that we don't breastfeed? I don't know. But it's good to know these historical facts that intervention in breastfeeding started way, way back in the time. I noticed in one of your slides that Asian mothers they are the target group that achieve the target as best as possible, over 80%. When they did a study in the Caribbean, and you know the Caribbean is a melting pot of different nationalities, it was also found that exactly the Asian mothers who also came to the Caribbean did best in breastfeeding their children. And is it a coincidence? Is it just a finding? Indian mothers were not slaves. So there was no intervention there. So they came with their culture to the Caribbean and they maintained their culture in the Caribbean. So even if you look at the data, you can see that there are interventions beyond our message of breastfeeding that interfere with breastfeeding. There was also a study done, a historical study, where they also looked at the Second World War, after the Second World War. That's the time when formula and other supplementary nutritional help me with the English word, feeding processes were introduced. So you see that economics also interferes with what we do. Can we beat marketing for formula milk? Do we have the same sexy message to promote the breastfeeding? So when you live in a country with low resources, these are all the aspects you have to take into consideration when it comes to breastfeeding. And seeing these data means that you cannot ignore what is the reality, even if this is a one-time measurement that we took. And let me jump the gun by saying that one of the reasons that I am so happy that I was introduced to Julie is because we have already started talking about how can the American University of the Caribbean assist us, and of course through this link also with the ABM, so that we will be able to document, record, but also, you know, make analysis from the data that we have and help us and assist us in making evidence-based policy. This slide is only to confirm what I said in the previous slides, that already at the age of 1 month, mothers start the process of weaning the child. And you see that most mothers in 6 months are very far in the process of weaning the child. And there is only 1% that start the process of weaning the child after 12 months. So how do we get them from knowing this, doing this, to increasing our numbers? Let me share one more slide with you with some data, and then I'm going to talk a little bit about what we then envisioned in doing 2015 and beyond. We also noticed that we were not very accurate in documenting our data. So accuracy in documenting data is also very important because the data has to speak to you. And from the 481 women that came to our clinic, we were only able to trace 126 mothers where we had information from all 4 periods in time. The information is not different, but if you really want to understand what is happening, you need to be able to see all of these mothers over time, at every time during the first year at least. So the information is still the same. Exclusively breastfeeding, gradually decreasing. The combination feeding, also gradually decreasing, most probably because the breastfeeding is decreasing, and the use of formula gradually increasing. So what did we do? Now we had the information, and as a department, a government department, we saw it as our role, our task, our responsibility to take the lead in this. So we started documenting our different stakeholders that are important and that play a role when it comes to breastfeeding of the child. In yellow, you see we are here in the middle, so we see government playing an essential role in this process, at least from now. And we identified our key stakeholders, where the key stakeholders are SMMC, that is the St. Maarten Medical Hospital. We have only one hospital on the island. So in a way, being a small island has its advantages. You don't have that many different stakeholders. So we have one hospital. We have the White and Yellow Cross Care Foundation. That is the foundation that does the postnatal care. Then we have the Labor Department, and I will get to that in a while. And we have the midwives, because although almost all children are born on the island, there is a small percentage that is also born outside of the hospital. And then the related stakeholders are the employers, healthcare providers, and daycare centers. Parents and their babies are our main key stakeholder because they are our target group that we pay attention to. So we sat down with the St. Maarten Medical Center to understand what it is that they do, because we also realize that it is important that you share the same message across the board. There should be uniformity in sharing the message for breastfeeding across the board through all stakeholders, with all partners. Whatever time of breastfeeding you encounter the mother and the baby, we have to share the same information. So we sat down with the St. Maarten Medical Center to discuss with them what is it that they do. And they have their policies and protocols, all of them written. They only started recently with that. I think it was at 10-10-10 at the time of the switch, that they started really documented their policies and having all the guidelines, so that the guidelines were not only known at the OBGYN, but that the guidelines were also understood by the pediatricians and the nurses working in the different wards. So the breastfeeding is initiated within 30 minutes after birth. So immediately within 30 minutes after birth, breastfeeding is initiated. But there are always some contraindications. So you ask them, but how do you deal with when it is not indicated to breastfeed? They have the Liquid Love Club. That is a group of nurses that discuss the different alternatives in preparing a mother to assist her if breastfeeding would be contraindicated in her case. Then there is also the Breastfeeding Nurses Committee, consisting of nurses from the OBGYN and the pediatrics, and daily meetings with the gynecologist and the pediatrician. When it is known before delivery that a mother will have challenges with breastfeeding, then it is discussed within the weekly perinatal meeting, and that information is then referred to the OBGYN and the pediatrician and the pediatric ward for their information. So they have a holistic approach in the hospital, and they are very proud of it. So when I called them and I told them that I was invited to do a presentation, and I would really like to include all our stakeholders in the presentation, they immediately shared this information. And although I don't have the correct number, and they couldn't provide me with the correct number, they said, I made it mostly because it was not a fact, but they said more than 90% of the neonates latch on successfully within the first 24 hours of birth. So that is a plus, and I do think that says that they really pay attention to promoting breastfeeding in the hospital. When asked what are the challenges that they are facing, and I will share with them what was also shared with one of the previous speakers, is their challenge is they don't know what happens after 2 weeks. So what happens? And I think the initiative of having them come back, or maybe having in the platform that we are creating now, have that feedback of what is happening, that would also for them be an important feedback to them, that the successful work that they did when the mother was in the hospital continued after that, because the other partners in the chain continued with the same best practice. So that's the St. Maarten Medical Center, but then the woman gets home. Most of the mothers stay in the hospital 3 days. They not really discharge on the same day. Most of them stay 3 days, but then they go home, and then is time running so fast? So then I have to really hurry. So then you have another foundation that kicks in, that promotes, of course, the breastfeeding, give information, share information on breastfeeding and diet, and make sure that also in the home situation, mothers are prepared to be able to continue the breastfeeding practices. We do have the fortunate opportunity that we have 2 lactation specialists in our baby clinic. So when the mothers come to the clinic, all of them see the lactation specialist, and when it is needed that they need continued support from the lactation specialist, then they get an appointment to do that. What are some of the activities that we do? We have introduced what we call the pregnancy market, and that is kind of a fair type of activity where we have businesses and other disciplines come and share their information, and where we start also the promotion of breastfeeding after pregnancy. So let me run you real quick, because this is just an impression of what we do, the outreach activity, and we also do sessions on give information, have sessions on breast is best and why it is important to breastfeed. But in 2015, when we looked at our data, we noticed that it was important to increase our activity, and here is where I'm going to invite Ivanka. Ivanka is a registered nurse working at our department, Youth Healthcare, and she was the champion in starting with a new activity at our department when it comes to breastfeeding promotion.
Which one is next? This one. Okay. Good afternoon, everyone. My name is Ivanka. I'm a registered nurse at the CPS, Collective Prevention Services. In 2015, they had already had different programs going on to give information out there. But what can we do to actually bring the crowd to us? So we started with a breastfeeding cafe. As you can see in the pictures, it's just short. You can see we started in a comfortable zone that the mothers will feel comfortable coming to us. We let also previous mothers that have been breastfeeding and had success stories or challenges also come out and give them some tips on how to best get rid of the problems they're having or the challenges. As you can see, we have this poster that goes out every couple months. So we try to do it 2 to 3 times a year. Now we're up to 4 in 2017. We have already had 2, and you will see in other pictures how it has gone so far. We also have a breastfeeding competition. It's also still a taboo within St. Maarten about breastfeeding anywhere. Breastfeeding is best. They try and hide and shun themselves away from breastfeeding because what people would think. So with this initiative, we took the challenging mothers to share their stories and share why they would breastfeed. And this came with the topic of breastfeeding and work, let's make it work in 2015. As you can see, all of the parents are at their workplaces taking pictures. So this is a school teacher breastfeeding within the school. This is a salesperson at her job and also a cafe specialist at her job. Um, as you can see, I don't know if you're seeing clearly, but these are some of the quotes that the parents put initially within their summary of why they chose to breastfeed. And this is our winner. She has been we have been using her picture to promote breastfeeding right now on the island. This is our second runner up, and this is our third runner up. Basically, all of them told us the reason why they breastfed is that they heard it from others and they wanted to experience what is the benefits of breastfeeding. We also had some that had challenges. This mom had a challenge of 14 days without a letdown, basically because of being stressed out and really wanting to doing it, not getting enough encouragement. It took a while for her to actually get the letdown process to come down good that the baby can be fed properly. She was, although a bit thrown off, still happy that she could have breastfed, and I can actually see up to date by seeing her at the clinic, she is still breastfeeding. So the child is now nearly 2 years old. So I'm proud of one of my moms. This is the next one we did, which is toddler time. Toddler time is based on the IQ levels that Dr. Haywood spoke about. And we don't differentiate the breastfeeding babies or the babies that are just formula fed. We invite all out that they can come and have the experience. It's a bit dark, but you can see all the children coming out to the activity where we have a speaker that is reading for them and helping the bonding moment between parents and children at that time. This is in 2016. You can see the breastfeeding winners here also. It was more of a challenge because now people are getting to know about breastfeeding and some wants to do it and some are still looking at the taboo factor that why am I going to put myself out there in the public? So I was happy that we had a less amount, but it was still good because these were proud to actually show it off. As you can see, our second runner-up went out into nature and get it all done. And also with that same mom, she breastfed both of her kids, as you can see here at one of our breastfeeding cafes. She has both of them, and she stopped breastfeeding her 4-year-old in order to start with the next one when she found out she was pregnant already. In 2016, we took a different approach with the breastfeeding cafe. We tried to go out in the community. We are allowing them to come to us at our location, but we tried in our different communities where we know it's difficult and we are seeing more teen pregnancies in those areas. We tried to go out to them. The response wasn't as high as we expected, but we still received the response that we know that they really do need the information out there in the community. Toddler time, once again, it has grown. This is one of my babies that has expanded so much. This year, we had a turnout of 43 children, along with their parents, bonding and having a good time with each other. As you can see, we have triplets in the midst, twins, and children even at the age of 6 started to attend with their parents along with their siblings. This so far has been 2017. We had one on February 15th and also on Wednesday, May 17th recently. And these are the sort of topics we have on the list. As you can see, we have babies here. What now? What to expect in the first weeks at home? So we try to give them, along with our stakeholders, different options and different information and where they can get that information from. So that's why we let our stakeholders come in and give out the information as much as possible. Okay, back to Dr. Asin. Thank you. I'm sorry for speaking so fast.
This is the last slide, also to round it all off, because what we also realize is that you also need to have proper policy and legislation in place. And currently, we only have pregnancy leave policy that is regulated by law. So breastfeeding is related to the pregnancy leave. But we are also signatory to the ILO conventions concerning the division of maternity protection. So we have to make sure that that information is integrated into our policies and legislation. We already have text adjustment for the civil code to comply with the convention. It is already drafted and it is now pending approval for publication. So when that is the case, then also through the civil code, the labor sector will be mandated to allow women facilities to be able to breastfeed. We also have in draft breastfeeding policy. We have in draft national guidelines for breastfeeding on St. Maarten. And thank you all for doing such a wonderful job of putting your information free of charge out there, because we don't reinvent the wheel. We take what we find on your websites and we adjust it. And we also have a draft proposal, Breastfeeding and Work, Let's Make It Work, to continue on what we started in 2015. That was our information, and this is what we wanted to share, what we do on St. Maarten. Thank you, good luck, and again, thank you, Julie.